Welcome to Our Invite. My name is Nima,
I'm Aaron.
and this is our first episode, our premiere episode, and we're joined here by Dr. Kernan, Dr. Bill Kernan. Thank you for joining us.
Thank you very much. Welcome and glad to be here.
Thanks,
Thank you.
Thanks for taking time out of your busy schedule. We know how that works, so appreciate you being here.
Happy to be able to be here.
So you can just tell the audience a little bit about yourself, maybe what they may not know about you.
So I am currently the executive director of pharmacy for Cleveland Clinic, Florida region.
Okay.
That's a relatively new role. I've been in probably over the last couple months. So before that, I was the director of pharmacy just for our Weston facility. But now I've incorporated or been given the honor really to be able to be over a total of 5 hospitals, which accounts for about 1,000 beds. It's got also 4 oncology infusion clinics, 3 retail pharmacies. With hopefully another one to be able to come. And I'm told that there's going to be more hospitals at some point in time down the road here in Florida as well.
good.
So really honored to be able to lead that many people and that great group of pharmacists, pharmacy technicians. So just really looking forward to be able to help promote the profession of pharmacy across a greater landscape.
How did you, you said you were a director for just one hospital, and now it's like all of them. How did
Yes.
you prepare yourself to go into that position?
So it's definitely been a little bit challenging, but I really just had to really give it a lot of thought to see how I wanted to be able to tackle it. Really, what my goal is to be able to take all the great things that we do here at Weston, as well as across the entire pharmacy enterprise for Cleveland Clinic, integrate that and bring that to the newer hospitals. Continue to do the great things that they do, because these newer hospitals have been functioning for a long time on their own. They've been doing some really great things with their pharmacists. We want to continue those things and we want to build upon it. And then we really want to be able to collaborate and work together so that we can leverage our best practices, our skills. We have some great pharmacists across the Florida region, and so we just want to utilize them to the best we can. We want to get them in front of patients as best we can to take care of patients.
So to touch on, the great pharmacists that you have a good reputation around the state of Florida. So what is Cleveland Clinic doing differently to prepare the pharmacists, get them in front of patients, things like that? Because a lot of different institutions are trying to do that.
So there's a whole handful of different things that we're trying to do, but I think the number one thing is to try to leverage and use technology. Okay. We have to be innovative, because we got to be able to take more care of more patients who are coming on to or who are coming to our hospitals and our clinics. In fact, one of our goals over the next 5 years is to literally double the number of patients that we're being able to take care of. So we really want to leverage and utilize technology. And that's really in all phases. So whether it's on our inpatient side, we want to utilize technology to be able to have safe compounding. We want to be able to have safe, effective delivery of medications to patients. But we want to try to use that technology so that we can get the pharmacists up in front of patients. We have a great electronic medical record. We have great dispensing technologies with our carousels, with our picture-taking technology that we use. And all of these things really help get the pharmacists out of the pharmacy, get them up closer to the patients so that they can impact the patient care, and so that they can be counseling patients, they can be helping to tackle medication access-related issues. We have a specialty pharmacy.
Okay.
That's actually up in Ohio, but they service our patients here in Florida.
Wow.
It's real simple. Our physicians can simply send the prescriptions to our specialty pharmacy, and then because they live in our electronic medical record, they live in Epic, they can manage the entire patient. They can help improve patient access-related issues. They can communicate to the physician. They do the prior authorizations. They help take care of any access-related issues for these very high dollar. And again, we couldn't do it without the technology to be able to do that. We also, on the outpatient pharmacy setting as well, we're trying to increase our bedside delivery. Again, we want our patients to be able to go home with their medications. We know that some patients, when they leave the hospitals, aren't going to get their meds filled. So these high-risk patients, we really try to target them. We have a great dashboard in our electronic medical record that allows us to tackle who are our high-risk patients, our CHF patients, our pneumonia patients, our COPD patients, the patients that are at high risk for coming back. We can identify them better. We can counsel them. We can make sure they leave with their medications. Do as much as we can here while they're here in the hospital to help better their care on the outside. And then we now have pharmacists in our ambulatory clinics where we can transfer them, and so that again, those high-risk patients, yes, they see the physicians, but they also see the pharmacists on the outside.
So you brought up innovation, how Cleveland Clinic is all about innovation. So you guys had the 2019 Medical Innovation Summit in Cleveland, I believe it was. Talk a little about the goals behind the summit.
So Cleveland Clinic is a global healthcare entity. In fact, we have a hospital in Abu Dhabi in the Middle East. Next year, we're going to be opening up a hospital in London.
Wow.
We have a clinic in Toronto, and we're going to have a clinic in China at some time over the next several years. Okay. So we're really becoming a global company, healthcare entity. So the Innovation Summit brought over 100 experts from, I believe, 20 different companies. Yeah. 100 different companies, over 500 experts, 100 different companies from over 20 different countries across the world to really be able to identify and be able to showcase the various different technologies. I think technology is critical to being able to tackle some of the different healthcare issues that we have today.
Like this podcast.
Exactly. There you go. That's right. Good technology here.
Yeah, because one of the main things we're trying to do with this podcast is reach a lot of people. For example, there's a lot of people that don't know what's going on, for example, at Cleveland Clinic, and we want to just make sure that they're able to see like the great things you're doing and things like that. So technology definitely is a mainstay in our culture, our population. Instagram, any social media is important. So we're glad you're on board with that.
We embrace it fully. In our pharmacy, in our outpatient pharmacies, our specialty pharmacies, we embrace and really have the top of the line technology. At our specialty pharmacy up in Ohio, we have a special compliance packager that we use as well for our high risk patients, so that they can get all of their morning meds together, all of their noon meds together, all of their evening meds together. They also then sync up every month. They call the patient and they reconcile that patient's medications for them because maybe there were some new meds that were added. So that way, when they send out their new pack for that next month, it's also synced up with them. And that med reconciliation with the pharmacist and the patient really helps to reduce errors. And then now, because of the compliance packaging, we're increasing compliance. So that's, and they've got this packer that will actually, this compliance packaging machine that will actually do this for them. So they can still fill very quickly and utilizing that technology to get that prescription done, but then the pharmacist can use that time to be able to go over those medications with the patients. So we really do utilize technology, and we're always looking for
that.
In our IV rooms. Again, we've got the latest and greatest of the video technology as well, using barcode scan med technology to be able to make sure that the technicians and the pharmacists are utilizing the right medications to compound. So we want to make sure that obviously safety is paramount and number one.
For sure. So a lot of people in pharmacy are scared of like technology taking over their jobs. What are your roles in keeping those jobs in place and also going forward with technology? Because you can't go away from technology as you already know.
Yeah, I think it's challenging to look out the next 20 years, but I think I think a couple things. One is healthcare is facing some really tough challenges. So we have to be able to improve quality. Of course. We have to improve access, but we have to take costs out of the system. So we cannot continue to do the things that we traditionally have been doing. So I think for pharmacy, what that means is we really have to change how we do things. And I think pharmacists have to get out of the business necessarily of simply dispensing prescriptions, and they have to look to how can we improve patient care? How can we improve health and wellness of patients? Pharmacists have to start identifying, testing out new models of care, or pharmacists are regularly in front of patients. the technology and the big tech, I think, will handle the dispensing of medications. Whether it's, we have new dispensing machines where they can take the top 100 drugs and you can go in and you can, input your prescription into the machine and you get your prescription out. So it's probably a matter of time before we have that. Whether it's Amazon, who knows who's going to be delivering, your prescription. You might be able to just send it to them, and then Amazon is going to bring and at your door is your prescription is going to be.
Have a drone flying in.
Yeah. I don't know how it's going to look, but I think these companies are going to figure out the aspect of simply getting the medications into a bottle, labeled properly, and sent to you. Pharmacists, I think, have to figure out how do we leverage our skills, and we have amazing skills to improve health and wellness, to improve compliance, to improve disease awareness, to improve disease literacy, to be able to take care of ourselves, which will then improve outcomes, keep patients out of the ERs, keep them out of hospitals, keep them out of doctors' visits. That's where pharmacists can leverage our unique abilities, and we're great at being able to do that. We just have to. We're still in this
box.
We get paid based on how many prescriptions we fill.
Exactly.
So, but I think it's a matter of time before we can get out of that, but we've got to continue to push that. That's why things like collaborative practice, provider status are really important for us to be able to obtain so that we can continue to push that envelope.
I think one of the big things we just need to do as pharmacists is, like you said, show our value. I think the general public just sees us as we put pills in a bottle and things like that. So how do you think we can change the public perception of the role of pharmacist? Because perception is everything. So,
well, I think we can do that every single day, whether wherever you're working, and how we interact with or outside of our profession becomes really, really important. We're really good at talking to ourselves within our profession, but how do we talk to those outside of our physicians? Whether it's physicians, whether it's nurses, whether it's healthcare executives. As a leader in my organization, I try at our C-suite level to always be touting the benefits of pharmacy and what we can do. I'm always trying to align pharmacy behind our organizational goals so that I can show our value. On the outpatient side, there's ways where we can help drive the bottom line for our organization, through our outpatient pharmacy, through our specialty pharmacies, through improved oncology infusion reimbursement. There's a whole ton of different ways that we can improve that through our pharmacists and our ambulatory care clinics, improving quality outcomes. There's a whole bunch of things that we can do. So we just want to make sure that we are really speaking very favorably and showing others what pharmacists we can do. I think in the retail settings, and really all settings, we've got to make a point to talk to patients about health and wellness, giving immunizations, counseling. And again, I know we're not always getting paid for these things, so that's what makes the tough challenge.
Of course.
But we have to continue to try to push that as best we can.
How do you feel the role of pharmacists is in Cleveland Clinic, like with the physicians? Like, sometimes a prescription might come in, and if pharmacists would like to make a recommendation, but they don't want to, step on toes or be rude, there's always that perception of like, maybe you don't want to do something.
So we've been working with our physicians for a long time. And I think that we have a great relationship. So a lot of that is about building credibility and creating relationships with them. We've been doing that for as long as I've been here, which is now about 20 years. But it has always been about, hey, pharmacists can work directly with you to help improve the drug therapy management, to improve the outcomes of your patients. If we start a new service, whether it's in the ED, whether it's in the ICU, whether it's our transplants, whether it's up on our internal medicine floors, oncology, we're looking to start a new bone marrow transplant service here in the near future. Automatically, we have to put a pharmacist on that service. And it's not me necessarily asking that. It's the physicians who are asking that. They are like, where's my pharmacist?
So they know the value.
Yes. And when my pharmacist has to take a few days off because they're taking vacation, they're like, where's my pharmacist? Need a replacement pharmacist. And I don't always have that, unfortunately. But
we're coming. Don't worry. We'll get our degree.
Give us a couple years. We'll be there.
You got it. Perfect. But I don't even necessarily today, because we have such a good relationship and because we've been able to show these benefits over the long time, I don't even have to go and ask them. They are coming to me asking for those. And I think on the outpatient side in our ambulatory care clinics, it's the same thing. I'm beginning to get where pharmacists, where the primary care physicians are saying, look, I need a pharmacist on my team. Okay. I need a pharmacist helping to manage my patients so that as the physician, I can take care of the more complex patients. And the pharmacist can help do that medication management. Yeah. They can help do that diabetes management. They can titrate the drugs, plus just counseling the patients, disease education, managing those outcomes. The pharmacists can do that. So they are now even more and more coming to us and saying, hey, we need those pharmacists there. Again, going back to collaborative practice, going back to provider sets, why we need to be able to get that. So then pharmacists can begin to bill and can begin to show their value from that standpoint. Not necessarily to make money for us, but to help with the entire organization.
Of course. So I just have a kind of a personal question. So on your personal time, what do you do for professional development? Obviously, you're at work a lot. We see that. You're working on a lot of different things. What are you doing on your personal time to, bring things back here at Cleveland Clinic? That's a loaded question.
Well, I try. I try to spend some time with my family.
That's good.
You always need that.
So work-life integration. A lot of people say work-life balance. I say work-life integration.
I know you emailed me back on the weekend. I was surprised. I was like,
that's automatic. So work-life integration is, that was coined, I heard first by John Armistead, the system director over at Lee Health, incredibly smart pharmacist and great leader, past ASHP president. He said that in a talk probably 5 or 6 years ago, and that still rings true every single day. But so you have to integrate. Again, technology allows us to be able to really be more productive, but we do have to integrate our home lives and our family lives, I think, with work. I try, besides spending a lot of time with my family, to be able to dissociate a little bit from work. But just from, I think, a continuous professional development, the thing for me that's really, really helpful is just building relationships and networking outside of our own organization. Seeing what other people are doing. That's where FSHP, my involvement in FSHP, my involvement in ASHP has been really, really helpful. I love going to FSHP meetings. I love coming to Nova and meeting you guys and talking to your guys' class, because even though hopefully I'm teaching you guys something, I do learn something from you guys as well. But it's through continuous networking, seeing what other people do. There's great ideas everywhere. We don't own all the great ideas. There's other systems, other hospitals, other professions that are doing some really great things, and you always want to try to be able to learn from those. You never know where a great idea is going to come. So just listen. But I think networking is a great way to do continuous professional development. Being involved in different meetings, going to other meetings. I started as president of FSHP. I've been able to go to more and more Florida Board of Pharmacy meetings. And so I've built relationships now with various Florida board members, and I've learned from them. Of course. These are things that I wouldn't have learned from. So my involvement in FSHP has allowed me to be able to grow professionally without a doubt.
Wow.
So you mentioned the other hospitals having kind of, also innovating. Everyone's innovating. So how do you handle competition? Because at the end of the day, you want to be the best.
Of course.
Well, I think, so from a pharmacy standpoint, I don't look at it like that, like, they're doing something, we've got to beat them to it or anything like that. I really see us all in the same basket for the profession of pharmacy. So if Memorial Healthcare or Baptist is doing something really innovative, or they're doing something really cool, I would really like to do that too, and I want to learn from them. or maybe there's somebody across the state doing it. That's, again, I think a big benefit to these societies, the statewide societies, the national societies, and then our local chapters.
Yeah.
When we have our local meetings here, there's always dialogue about, hey, what are you guys doing? Oh, we started doing this, and we have this technology, or we're starting to put pharmacists here, or we're doing that. You can always learn. I also am involved in ASHP, and I'm on a section advisory group for the frontline leaders for ASHP. And so we have leaders from across the entire country who we get on a monthly call, and we discuss maybe change management, or we discuss how we are professionally developing our younger leaders. And I'm learning from the way people are doing things in Washington, the state of Washington, California, New York.
Awesome.
So it's just that networking really, really helps a lot. But yes, we do definitely compete. We want more and more patients. But from a pharmacy standpoint, I never see it like that. I always try to see it as, hey, let's move the profession
one big bowl.
forward. Exactly. It truly is.
Healthy competition.
It truly is. It's great to be able to see another organization's pharmacy department do really good things. I take a lot of pride in that as a pharmacist, just in general. It is awesome to see all the good things that they're do. It's great for our profession as a whole.
So taking it back to a little back, to when you were not Dr. Kernan.
Yes.
So back in Purdue, you graduated from Purdue University.
Yeah.
If we were
in 1993.
We didn't want to, you know.
I was born in 1993, by the way.
It's crazy.
So
crazy, ridiculous.
If we go back and we ask your teachers or even your fellow classmates who Dr. Bill Kernan was, who would they say you were?
Well, you can lie. You can lie,
but we don't want you to. We don't want.
I think it's really pretty simple. There's really two things I try to do. I try to, I try to be very humble. I try to listen. I try to build relationships with people. I try to look in the mirror when I need to look in the mirror. I try not to, so if we don't do something very well, I try to see, well, how can I learn from that, and how can I improve, and how can, do I need to be a better leader? Do I need to be a better manager? Do I need to work harder? What do I need to be able to do? So I've always tried to be humble. I've always also believed in teamwork. I love studying and learning about teamwork and what makes teams very, very effective. I think that's also really important for any one person's success, is to understand what are the key things that allow teams to work, because you can't get anything done by yourself.
We talk about this about every day.
Yeah, it's so true. I think there's a lot to be learned from team sports, that dynamic, bringing that, not everything, but parts of it to work. How do we function as teams? So I like to think of myself as, I would hope they would say, as a good team leader.
We'll ask and let you know.
There you go. So being very humble, I think being a good team leader, and I think just working really hard. I think I'm a believer that you can learn anything, and I wouldn't have thought that I could sit and do a podcast, but I've learned or tried to work hard at it, or whatever the case. I would never have thought that I would have become president of FSHP. But through working hard and through learning and working with others, I've been able to get there. So I think that's also, so working hard is really important. And I think a big important part that goes with this, and this comes from my boss. This is not my term. This is something that he has said, which is to have a bias for yes. So when people ask you to do stuff, you got to say yes to it. You don't want to say no, because then they might not ask you again. You want to say yes, and you want to give it your all. A few years back, they asked me to start the political action committee for FSHP. I've never started a political action committee before, but I said yes, and I'll learn how to do it, and I'll figure it out, and I'll find as many different resources and talk to as many people as how we can do that. And we've been very, very successful. We've raised over $100,000 over the last 3 years for political action committee, which goes right towards our political advocacy for pharmacists. And hopefully with that, we'll be able to achieve soon provider status or collaborative practice. But had I said no to that, I might not be president today, because that allowed me then the ability to get in and show kind of what I can do. So I think you have to say yes to things. You have to work hard. You have to then work with people really well. You have to listen. You have to take accountability, and just go from there.
Yeah, I think people really underestimate the teamwork aspect of anything they're doing. Like you said, you can't do anything in life and get to the pinnacle without a team. Nobody gets there by themselves.
And the keys with teamwork, to me, the number one thing with teamwork is building that culture of trust and safety within that team that allows really everybody to be able to work at their best. If people don't feel safe, if they don't have trust, then they tend to shy away and they tend not to perform at their top level. But if you can get a team where everybody really trusts one another, feels safe to be able to go out on a limb and do something, they're not worried about failing, they're not worried about saying something that others might perceive as not being good or perceive it as being silly or stupid. If you can get people comfortable to a point where they are sold 100% into what they're doing, the team will really move forward.
How do you go about implementing that in your team here?
So it's a lot easier to say than it is to do, but I think it's about building relationships. So the better the relationships people have, the safer and the more trust they have. I think it's about meeting with them, being present. So it's one of the challenges I have now in my new role. I now, so instead of just being over Weston, I'm now over Martin. I'm also over Indian River. I really am working to try to make sure that I'm present at those different facilities, that I'm involved, that I'm at meetings that they are having. And that will allow me to be able to build better relationships with them, grow their trust in me, as well as for me to be able to really trust them. And the longer we go out, I think the better then we're able to create that team dynamic. So I think it's about being present, building relationships. That's critical.
So myself and Nima talk about this all the time. We all got here for different ways, different reasons. So how did pharmacy, like why pharmacy? How did you pick pharmacy? I know for me, it was just an opportunity that fell in my lap and I took it. I'm really big on just taking opportunities. His story is different from mine. Why pharmacy
so
for you?
I started working in a pharmacy when I was in high school.
Okay.
And really loved working there and began to just really enjoy learning about pharmacology and learning about how medications can help patients. And so that's what got me initially interested in it. Then once I got into pharmacy school, I realized the benefit of doing a residency. So residency is really, really important. I can't emphasize that.
We have a resident sitting right here.
And the reason that is because it allows you to build on those knowledge and skill set that you learn in school, but that 1 year, and ideally you do a PGY2 as well. I really encourage doing a second year as well, but it really allows you to build those skills that are gonna basically be the foundation for the rest of your career. I wouldn't be where I was today without my residency. It's that simple. For decades, I literally relied upon what I learned in my residency at various different times. I looked up to everything that they did throughout those years and, again, drew on that experience. Without it, I really think I would not be where I am today. So I think that's incredibly important. And I think, and again, I didn't do a PGY2, but I encourage people to do a PGY2. If I could go back and do it again, I'd probably do a PGY2, but
Hey, it's never too late.
well, maybe for me, but the residency is really, really important. And that's what's been able to, so then I did clinical pharmacy, direct patient care for a long time, started the residency program here, not by myself, with the help of others as well, with a team, started the residency here, and then really have enjoyed being able to have a broader impact on what we've been able to do here in Weston, and then really what we can do across the system. I really, really look forward to that. And so that's what's drawn me to the more administrative aspect is, hey, not only can I do something for just this one segment of patient population as a director and an administrator, I can impact a broader scope.
So for your position as FSHP president, it seems like you said, you always said yes to everything, and it just kind of came towards you. So why did you pick to become the president of FSHP and not ASHP or PHA or AMCP? There's so many organizations out there.
Did you just say yes first?
Did you say
yes? So that has been the path of myself getting involved. That path can be different for others. I think number one, what's really important is you got to get involved in an organization. So even today, right now, we have in Florida about 30,000 pharmacists. Yes. There's only about 3,000 pharmacists that are members of our two major societies, Florida Pharmacy Association, Florida Society of Health System Pharmacists. 3,000 out of about 30,000. So 1 out of about every 10 pharmacists are only organizationally involved. And really, to be involved, you don't necessarily have to be you don't have to be an officer. You don't have to be going to committees. You don't even necessarily have to go to that many meetings. Just be a member, because that supports the organization as a whole. But my path was getting involved through our local chapter here at Florida Society of Health System Pharmacists. There were some other great pharmacists who pulled me aside and was like, hey, we need some help. Can you do some things? Can you help plan education? Can you get involved a little bit? And of course I said yes. And that's what led me also down that path to get more and more involved in FSHP, and then ultimately ASHP as well. The other thing too is that my boss, the chief pharmacy officer for Cleveland Clinic, really also pushes organizational involvement. Okay. He believes very, very much in organizational involvement and how that can lead to the success of the profession of pharmacy. So he also, he doesn't just like that I'm involved in ASHP or FSHP, he expects it. And that's really how all of us really need to be. I think all pharmacy departments needs to be just automatic that you are a member of whichever organization you feel best helps it. Yeah. So I've always been a very big advocate of that. And so that's how it's been I've gotten into it. And then, like I said earlier, it has tremendously helped prepare me for this position. It has helped me grow professionally because, like I say, I've done things that I would never have done. I've now as president, I get to lead the board of directors. So I get to lead this organization for a year, and I get to hopefully help bring more people into the fold, help advocate for pharmacists, advocate for pharmacy technicians, look to try to bring clinical, we're working to try to bring clinical sections to FSHP so that ambulatory care pharmacists, oncology pharmacists from across the state can network and can work better together. So I get to be able to help do that. So, what an honor and how much fun is that? So it's really a great thing to get involved.
So what do you see yourself doing in the next, I say, 5 or 10 years, or I guess what is Cleveland Clinic as well doing? I know that's a broad question. But
well, we have to continue to push, again, pharmacists in front of patients. That's the number one thing that we are working to try to do. Again, utilizing technology. Speaking of technology, so artificial intelligence. Maybe we can utilize artificial intelligence of our electronic medical records so that pharmacists don't have to verify orders anymore. And they can just be up on the floors looking at patients, because as a physician puts in an order, the technology can screen that order, can trigger things to maybe kick out to a pharmacist, but those things that don't need to be can just go right through, and a pharmacist doesn't have to necessarily look at that. Let's get pharmacists doing things in front of patients. So, utilizing artificial intelligence, utilizing the latest technology, utilizing big data, that's where we want to go so that we can get pharmacists in front of patients.
So we're in a social media era, obviously.
Yes.
How do you think? What do you think the role of social media is in healthcare, and how important do you think it is?
Well, I think it is incredibly important. I'm not a social media expert, so I do like Twitter. There's no doubt. That's actually the only way.
Start.
That's the only way I keep up with my clinical information. Infectious disease on Twitter is amazing. Yeah. I mean, that is exactly how I keep up with the latest literature.
So follow Dr. Kernan on Twitter.
Yeah. Don't follow me. Follow all those people I'm following. You'll be able to see. But that's how I keep up. But no, I think for social media, the importance is just the education, particularly to patients. whether it's health and wellness, whether it's service lines, whether it's the latest and greatest, getting your flu vaccine, we can utilize and should be utilizing social media to get the word out to educate people and whether it doesn't matter whether it's Instagram, Facebook, Twitter, you name it, whichever one. LinkedIn.
Yeah.
I knew I was missing one, but whichever one, Snapchat, whichever one it is, we need to utilize these to get information out to people. And so that's, I think, the huge benefit. There may be others as well, but to me, that's the number one benefit. Cleveland Clinic tweets out things all day long about new service lines, about health and wellness, about opiate-free orthopedic surgery. I mean, just options and things like that people may not even know that they have. And without social media, it's difficult to get that message out.
So when you stepped into the role as the executive director of pharmacy here at Cleveland Clinic, what was your number one goal? You're like, when I'm done, I want to have this finish. I want this to have changed or be pushing in this direction. What is your number one goal that you had when you want to finish?
It's a lot of what I've just been saying, which is getting pharmacists in front of patients. Okay. That's my number one goal, is to maximize the use of pharmacists to help deliver and improve patient outcomes. Our mission for Cleveland Clinic Pharmacy is to provide pharmacy practice across the continuum of care through innovation, research, and education. And it's really exactly that. Let's utilize technology, let's do research, let's do education, and let's maximize the outcomes of those patients. It doesn't happen overnight. It doesn't happen tomorrow. We have to take care of patients in today's world of how we do things, but we have to continue to try to innovate. We have to invest in that. We need to grow our residency program so that we're growing our education. We have a ton of students here in Weston. One of the things I want to do in this new role is to bring more students to our other facilities. I want to grow our residency programs. I want to add PGY2 programs. What does that do? That's going to make our entire pharmacy department that much stronger and grow our presence. And the great thing is that our C-suite is totally on board with doing exactly those things. They want to be able to do that. The chief operating officer of our region is a pharmacist.
Oh, wow.
So
that works out pretty well.
That's right. It sure does. Pharmacists have great skills to be able to help manage in healthcare, and he's an example of one. So that's the goal of what we want to be able to do. And then just going along with what I was saying about teamwork, it's making sure that we collaborate as a great team.
Of course.
It is a challenge because we're an hour and a half to 2.5 hours away.
Yeah.
So I'm not sure how we're going to do that, but we're going to utilize technology. But we're going to make sure that we work together. There's no reason why a pharmacist in Weston couldn't help a pharmacist up in Vero Beach.
That's a good point. Yeah.
We're all on the same technology.
Yep.
I can jump into their patient's electronic medical record.
Yep.
I could probably even video in here in the near future. So again, technology is really, really critical, but that's what we want to be able to do. But the two have to work as a team. And so we've got to be able to build that teamwork.
Talking about residents, what is one thing that when you see a resident coming for an interview that you look for that you think is lacking, you don't see as much of, let's say in the past 2 years? What's something that's lacking that you look for?
So I like to look for professionalism. I don't want to say that it's lacking, but I see a decline over the years.
Okay.
Maybe that as the schools have increased, maybe there's a little bit of a lower attention to that. So for me, that's what I like to see. I like to see professionalism. I think, and that's not the only thing as well too. I think, the clinical skills and the clinical knowledge base is really, really important. Mm-hmm. So as students who are preparing to go into a residency, I think you got to make sure you take good rotations and not try to shy away from harder rotations. Take good, strong, tough rotations in critical care, infectious disease, internal medicine, things that are going to build your knowledge base. And so sometimes I see a drop off there too as well. So those two areas to me are really, really important. Those to me are your foundation. Good professionalism, strong knowledge base are huge.
You might have answered this already in that question, But I guess the total opposite. Let's say a candidate is average, but what is that one thing that makes you stand there? Like, all right, I think I'm gonna give this person a chance because they have this and they don't have the other stuff.
Well, so I think that the professionalism is really important. If they can demonstrate their commitment and their willingness to be able to adapt, their willingness to take on, to be a good resident, you have to really be very flexible. You really have to be incredibly committed to this year, because it's a lot of hard work. It's very manageable, but it is a lot of hard work. You will definitely be tested. And so you want to see that candidate can handle that. And you want to see that candidate is really committed to being able to do that. Okay. So I think that's also another aspect that I'd like to be able to see.
Yeah, one of the big things that we hear from a lot of our colleagues is how do I stay well-rounded? A lot of people have great grades. A lot of people have connections. Yeah. It's hard to do both. So I guess let's say you have a student that has a 4.0. But has no leadership roles there.
Yeah.
Or you have the student that does everything, but they have like a 2.5. I guess what would you say to the person trying to get, I guess, where you're at one day, what they should be doing to put themselves in that position?
Well, they got to work hard, and they do have to realize that they need all those different aspects. So we evaluate exactly that. We do look at GPA, because we think that that's an indication of how hard that they have worked and their effort that they have put in over time. So GPA is important, but then we do look at their organizational involvement. We look at perhaps some of their project involvement that they have gotten into. What are some of the things that they're doing outside of the traditional schoolwork? So we do actually evaluate those different things very equally and very fairly for that standpoint. We do want to see that entire broad scope.
A well-rounded person.
Yes, absolutely. But you always want to, again, I go back, doing good, strong clinical rotations, doing well in school. That is very, very important. I mean, you do have to build that knowledge base up. But you're right. You should be involved organizationally. You should be doing some things outside, because that also shows your commitment. It shows your ability to say yes, to get involved, to get outside of your comfort zone and get some of these things done. And that's what you need as, to be a good, successful resident.
How do you think your role of FSHP has affected your position as executive director of Cleveland Clinic?
So I think that has helped. It complements itself very, very much. So as FSHP president, I am the board of director for the board. That encompasses also, I have to be financially responsible for FSHP, just like for 5 hospitals. I've got to be financially responsible to make sure that I'm a good steward of our finances for both our inpatient pharmacies, our outpatient pharmacies, our oncology pharmacies. With FSHP, it's the very, very same thing. So they complement one another very, very well. But it also gives me, I think, a greater satisfaction to know that I'm helping the profession across the entire landscape of Florida too, as well. And so while I'm trying to do it here with all of our different pharmacies, inpatient, outpatient, oncology, I'm trying to do it across Florida. So it really complements itself very, very well.
So I guess what is the biggest area, I'd say, in terms of pharmacy for the state of Florida that you would love to see us improve in? What do you think we can work on to? Because I hear we're not ahead of a lot of other states. So I guess what do you think we can work on to push ourselves? Because we have everything we need to be the best. What do you think we need to do?
So I think we have to grow our organizational involvement, but our number one thing we have to do is get collaborative practice, because that will allow us to be able to push, I think, new models of care for pharmacy in the outpatient setting. It will allow us to be able to get in front of patients, ultimately to be able to bill for our cognitive services, our abilities to help craft patient management, drug therapy management. it's tough for us to move forward without that. So to me, that is the number one thing. You know, there's other things that are good things, like you might hear test and treat.
Yes.
And I'm for test and treat, and I get it, but it's also incredibly very, very narrow, right?
Yes,
it's
it
basically
is.
just
Yeah.
one thing, whereas collaborative practice is very broad. And it really will allow us to be able to take the next step, I think, to be able to move forward. Again, we've got to, you know, things like test and treat are very, just very, very limited. And it's really one dynamic in one arena in the retail setting, and that's it. Whereas collaborative practice could ultimately, over time, change all landscapes.
Yep.
It can change retail. It can change inpatient. It can change ambulatory care clinics. So that's why I think that really is to me, it is the number one thing. And we don't need it just at the state level, but we need it at the national level. We've got to continue to push this, because long term, again, dispensing medications is not where we need to be. We need to be in front of patients utilizing our skills. And there's a ton of need for that.
So you say you always say yes to everything. So there has to be a time that you've said no, because I mean, if you keep saying yes, it builds up, right?
It sure does.
And there's gonna be a time where it's gonna crash. So there has to be a time. So when would you advise someone that has the same?
Well, I think you gotta just you gotta introspect and just look at your work-life integration, and you just have to see where you're at. And you're right. There just might be some things that you can't say yes to. You do have to make sure. Life is about balance. Exactly. You have to be able to know where you're at. So yeah, sometimes you do have to say no. You just want to be careful about that, and you want to make sure that. That's why it's a bias for yes. It's not always say yes. It's a bias. So have that bias towards it, but sometimes it means no.
So before we end the show, do you have anything else you want to tell the people?
I just want to say, make sure you get involved. Join your organization. I'm biased to FSHP, but just join an organization. We need and we dearly need more pharmacy involvement. And as a profession, we need to come together. We need to get involved. We simply just need to get off the sidelines.
Of course.
So that's my number one message for everybody. Just get off the sidelines and let's get going.
Perfect. Right. Well, it was a pleasure having you. Thank you for joining us.
Thank you
Thank
so
you
much.
all.
No
this
problem.
has been great.
Thank you. And my name is Nima.
I'm Aaron.
And this is our invite.